Good afternoon. Welcome to the Special Superintendent's Webcast on August 11th, 2020. We, of course, have a packed agenda today, and we will be discussing the recent development that was addressed in the governor's press conference yesterday. You can see the agenda that we forwarded to you. The agenda has changed just a little bit. We had a typo on there that we fixed, and we then added in the discussion on Governor Beshear's recommendation yesterday. We actually looked to see if we could take off a few agenda items and defer until next week, knowing we would need to take a lot of time to discuss the recommendation. But all of the agenda items you see on there, those are all relevant to work that's going on now. We need to address these issues, so we're going to try to get through everything and then devote ample time for the question and answer and the discussion on the return to in-person classes. So once we get into all these issues, you'll understand that we want to cover these, knowing that many of you are already starting with virtual learning. Tony, can you advise if the Lieutenant Governor is in yet? We are going to mix the agenda up a little bit due to the Lieutenant Governor's schedule. We're going to go ahead and have a discussion on the recommendation to delay in-person classes. If she's not in, Tony, we'll go to you for a quick communication update.
I don't think I see her yet. Does anybody else? I don't think I've seen her yet.
I think she's coming from one engagement to the next. So Tony, why don't you go ahead and start? We also have special Superintendent Marion Sowers with us today. She's actually just joined the lobby.
Joined the lobby, so we'll go ahead and go back to our originally scheduled unscheduled plan.
Lieutenant Governor, I was just explaining to the superintendents and our guests that we had the discussion originally down towards the bottom of the meeting, but due to your schedule, we're going to move that to the first item to have a discussion on the governor's recommendation yesterday to delay the return to in-person classes until September 28th. I will defer to you for a brief summary, and then I'll make some comments, and then we'll devote some time to questions while you're available.
Okay, thank you so much, and thanks for adjusting your schedule. I apologize for that. But thanks everybody for joining us today. I'm sure many of you saw the press conference yesterday where the governor had to make a recommendation to you all that he really didn't want to make, but felt necessary in terms of the health and safety of our schools and the people in them. The recommendation, as many of you know, is to push in-person classes back to September 28th. That is not to say that school cannot resume digitally when you need it to. And it certainly does not rule out the possibility of us being able to work with KDE on potentially some guidelines for small groups and things of that nature. I guess I will kind of just leave it at that because that's pretty much the nuts and bolts of it. I know there are probably lots of questions and comments that we need to listen to from you all, and I'm happy to do that. And I know I'll be on for a little bit, and of course the commissioner will be here for the duration.
Thank you, Lieutenant Governor. We will take the advantage while Lieutenant Governor is on here to take some questions related to this issue. We will then go on with the agenda, and then we will end with question and answers that also, I'm sure, will deal with this same issue, and we will still answer those. However, Lieutenant Governor probably won't get with us at the end of the webcast. I do want to, before we take some questions on this, and Tony, you can start looking to see if we have some. I'm sure we do. I want to go over, the governor did a really good job yesterday of talking about the thought process that the Lieutenant Governor, the Governor, Public Health, and others utilized to come to this recommendation. One being that we have an increase in total cases. We've all seen that over the last few days, and it's gone up and down. But then the positivity rate, which is, I understand to be more concerning from the public health perspective, has gone above 5%. I believe at one point on the weekend it was about a little over 6%, which is alarming. We want to be under 5%, certainly under 5%, and some other states have a much lower threshold than that to return to certain activities like New York. And then the governor stated that we're seeing that this could be the possible apex. We hope it's the apex, but of course it could keep going up. But we don't want to be opening schools into in-person classes during the apex or a potential continued rise of cases. That was a factor considered. Also, who is getting the virus? We continue to have reports from public health, and the governor goes over those on his press conferences about the increased number of children getting the virus. And it is being shown now that children obviously can spread the virus. There are also some other studies that certain ages of children have a really high amount of virus in their bodies and their nasal cavity. And so that gives additional concern because obviously we're educating children and they are carriers and then can obviously pass that along. They can transmit. Number 3, the experience in other states, Indiana, Georgia probably be the most prominent. A school district we've all seen with packed hallways, no masking, and then they had to shut down a few days later and had over 250 students, staff members quarantined as a result. Don't want to repeat that. The governor talked about being learning from other states. And then I also will add in, I heard Secretary Arnie Duncan, former Education Secretary, U.S. Department of Education, talked about school districts nationwide need to treat this as a marathon, not a sprint. And that goes right in line with what the governor was talking on the 3rd reason. And then the 4th reason, we're still seeing Kentuckians go traveling, going on vacations, going to places, and we all know we need a vacation, but the concern being going to popular destinations that have a very high rate of the virus coming back into Kentucky. The governor, I think, used an example of a wedding that some folks he knows personally went to, and it sounds like the entire wedding party has had the virus transmitted, using that as an example. 4 main reasons why we need a statewide recommendation. And also, I think, Lieutenant Governor, correct me if I'm wrong, the governor made reference to the fact how some of the national advice we're getting from CDC and NIH indicating that these are the warning signs of when you need to take statewide steps. And so all of that factored into the recommendation to delay in-person classes until that date in September. So I also want to mention that the governor talked about bringing in smaller groups of students and groups of 10 or so for various important reasons. And we're going to be working with public health over the next few days to get guidance to districts. We're hearing from you. I spoke to a superintendent today, was very passionate about some of the things that she thought that district could do, just utilizing some flexibility of bringing in 10 or fewer. And so the governor used the example of coming in to get your Chromebook and maybe getting an orientation on technology. It's a great example. We want to also be able to have that for other reasons as well. So we're going to keep working with public health to see what might be permissible. The key is we don't want a lot of repetition, and it needs to be spread out and obviously in small numbers, but there are also some negatives to that, and we can talk about that. I don't want to take away from the time of Lieutenant Governor's here, but there are some drawbacks to that as well as how do you spread your teachers out, equity, and everything else. But no, we are hearing you when you talk about wanting to take advantage of some of those flexibilities, and we're going to be working with public health to see what that looks like and then producing guidance hopefully as early next week, if not end of next week, on how that might look. So any other follow-up comments, Lieutenant Governor? If not, we can go into some questions while you have the time.
Yeah, and let me just say this. All of you know, I was a teacher. I was an assistant principal when we filed to run for office, just a couple years ago. And so, I've been in the classroom. I've been the one that got the kids off the bus. My husband's a teacher. He started his in-person professional development yesterday. We have a son who is a senior in high school. If there's any group, certainly that is going to start the year off in a very odd way that they didn't expect, it would be the senior class. We had a senior last year who didn't get to graduate in a normal graduation. And so I tell you all of that to tell you that I not only do I sympathize, I empathize, because my family is directly impacted in the same way that every adult and child in your building is, because most teachers have kids in the school system and can relate to these things. But, you know, in the month of July, there was a 40% increase in the number of kids who tested positive for COVID-19. This virus continues to evolve, and our knowledge of it continues to evolve. And so in some cases, I'll just be very honest with you, there are some false equivalencies being made. You know, going to school is not like going to the grocery store. You know, there are very different circumstances. And so, you know, it doesn't help when we have folks out there making false equivalencies, because all it does is muddy the water and makes things even more difficult to work through. I will say, and I've talked to the governor at length about this, if anyone asked me, do you trust our schools to implement this guidance to fidelity and do it the right way? Without hesitation, my answer is yes. Our teachers wake up every day and care for those kids. The bus drivers build relationships with those kids. The people who serve them food in the cafeteria, they know those kids. We love those kids. The problem is, if the very best school system did everything the exact right way, those kids still walk out the door every day at 3 o'clock, and we don't know what happens between 3 o'clock when they walk out the door and 8 o'clock the next morning when they walk back in. And so I want you all to understand, and I hope that I can convey this to you, that this has nothing to do with doubting that our school systems can do this difficult work. We do difficult work every day. You know, there's no question in my mind that it can be done. The question became, is it worth it to go through all of that every single day with these kids just to have them go out and do who knows what, who knows where, and bring the virus back into the same people who are doing that really difficult work every day? And at the peak of a virus, the answer was no. Now, when we get on the decline and things start to look a little different, we're very hopeful that that changes. But I would just remind you that this is a 6-week pushback. As a teacher who got her classroom ready, I can't imagine trying to get my classroom ready physically, but also getting a digital classroom ready at the same time and not knowing what was going to happen from week to week. And so to make this decision and to push it and to give people a definitive way to start the school year, even if it's not the way we wanted to, was the best we could do for preparation's sake. So just keep in mind, this is 6 weeks. If everybody goes out and does what they need to do, and we wear masks and we take care of this and we crush that curve, then this, you know, in-person classes are a possibility. And that's what we all want. And so if anything, rather than creating false equivalencies, rather than, you know, muddying the water in your communities, be an example of what we need our communities to do for our kids to go back to school in person. Please do that. And let us know how we can help you. I'll make a video for every school district in the state if I have to. Many of you have reached out, and I'm happy to do that. But, you know, just keep that in mind. We've got to act in good faith. We've got to value the health and safety of the folks in our buildings and the families they go home to at night. And that is paramount in this decision.
Thank you, Tony. Let's have some questions. The Lieutenant Governor, we want to be respectful of your time. If you just want to signal when you have to leave, and then we'll start in with some questions.
Okay, so right at the top of the soapbox with 21 likes is the word recommendation. Seems to be the biggest point with our superintendents. They say the word recommendation needs to be more of an order and sent from the Department of Education or the governor, because the word recommendation is what's really hurting them as superintendents.
I can start, Lieutenant Governor, if you want to follow up after me. And I've stated what I'm about to say to many of you, some of you last night, some of you today. Also, while I'm thinking about it, there are at least 2 that I owe a call or a text to that I missed this morning, and I will get to you this afternoon. I apologize. The governor and Lieutenant Governor administration have been very clear, and we have prided ourselves as a state that education decisions related to COVID have been done through recommendations from the governor based on the best medical expertise that Kentucky has to local school districts to then implement those recommendations. And up until now, and there's been, of course, some pushback here and there, but we have all complied, all 172, now 171, after July 1st, school districts have done that. That's a point of pride for me. It's a point of pride the governor, you've heard the governor and Lieutenant Governor talk about. It's a point of pride because it does still recognize local control, but it also provides you statewide expertise in what we're dealing with in a medical pandemic, and that when certain metrics rise to a certain level, statewide recommendations need to be made so that then you can follow them to protect your local community, but then that also protects the entire state. And we just described those 4 factors that the governor and lieutenant governor utilized to arrive at this decision. And so that's no different on this one. So it is a recommendation. And however, there are things that the state can do. The first thing that if one of you were to say, Commissioner, we're not going to abide by the recommendation, we are going to go ahead and start school August 24th. The first thing I will do is ask that we schedule a conference call quickly between myself, Chair Young of the State Board. I would also ask incoming Commissioner Dr. Glass to join the call, and we would ask to meet on the conference call or through Microsoft Teams with you, your board chair, your vice chair, and if you want to have your legal counsel there, not to be adversarial, but to have everybody around the table on issues that might come up and have a discussion. Why is it that our district decided, we want to know why you decided to go against the recommendation of public health, the governor and the department to go ahead and have school, have that discussion. My goal would be to have a different outcome at the end of the conversation. And that would be a goal that I think could be achievable. Related to this, I contacted Kentucky School Board Association this week or today, and we are planning on having a statewide webcast for all local board members to participate, to explain the decision, to explain the recommendation, to explain what happens if the recommendation is not followed, or the potential to what could happen in a school district because we are in that rising nature of the cases, hopeful apex, but it could be continuing to rise. And we'll also be issuing written communication. We know that you are getting a lot of pressure from your local board members. They are elected officials. They are, of course, getting pressure when in their local communities that they represent. We understand that. We understand it's putting you all in a very difficult position as the CEO and superintendent of the school district. But I'll go ahead and answer the question that I know is next. What are the ramifications? These are potential. These are what is available. I want to be honest with you. I don't know that any of these would ever be utilized. The discussion will definitely be utilized. You will definitely be having a discussion like I just described. The governor, of course, does have executive order authority, and that was implied in the question, how the question was phrased. Why is this a recommendation? The governor does ultimately have executive order in a pandemic. The Cabinet for Health and Family Services, we all know that local health departments and I believe also the Commissioner of Public Health have very broad broad authority to close public buildings, including school buildings and a group of buildings, being a district, during public health emergency if the public health requires it. The Kentucky Board of Education has emergency or authority through emergency regulation if they chose to pass an emergency regulation, if they believe that the health and safety of the common schools were in jeopardy, and that is an option. There's also an option to have the discussion, and if your district decides to go on anyway and have school on August the 24th, and we don't trigger any of those options, but there will be local consequences. There'll be a lot of folks with fingers crossed that nothing will go wrong. There'll be a lot of us, and you included, with fingers crossed that the mask situation in your high school won't look like North Paulding, Georgia. And many of you have said it will be a challenge to keep everyone with a mask on. But if you were to go back in the height of the pandemic, then there are a lot of things that could happen you could end up having to close school a few days later. It could really get out of control, and you'd be included in national media. None of us want to see that. On the other hand, you could go back and you could implement it just like the Lieutenant Governor has faith, and I do as well, that it could be implemented, and you can implement your plans and you would be successful in it. However, one of the reasons is for the recommendation, I go back to the 4 reasons, is the virus is widespread. Even though it may have more cases in Fayette, Jefferson, and others than others, it is widespread across the state. All counties in Kentucky have people going out of state to vacation. We know we have people that go to work and to buy for commerce among our different communities. We don't just stay in Garrett County. We go different places. All of those factors that, while Kentucky is somewhat of a rural state, it's also a suburban state, and it's a state that goes from one county and one community to another to do things, to worship, to go to school, to buy things, and to see family. All of those things add up to the reasons that our officials at Public Health made this recommendation. The demographics of the state, where we're located, the fact that we're on 2 interstates, all of these, or more than 2 interstates, but 2 major ones running north to south. All of these things are factoring in to this statewide recommendation. So I say all of that to say that yes, it is still a recommendation. We have a great track record in this state with recommendations based upon the public health. To the extent that you're getting pushback from your local board members, I need to redouble the effort and make the effort to communicate with your local board members, and we're going to do that, and hopefully that will assist you. But the primary thing is we're going to be having a discussion, a very intimate discussion between those parties I described if your district is one that decides to defy the recommendation.
Okay. The next question, oh, sorry, I think I have an echo. The next question that I have is what additional measures, such as no fans at the Kentucky Derby, is the governor planning to take in addition to shutting down schools? It seemed that what was done with the bars and the restaurants yesterday seemed to contradict the decision on schools. They just want to make sure that there is some consistency.
So I think I'll go back to my comment earlier about creating false equivalencies here. Events and places of business are not the same thing as a classroom or a school hallway. They're just not. In terms of what's going to happen with fans at the Derby, that is yet to be determined. I think just like the governor has tried to wait out as long as he could the numbers and to get as close to school as he could before making a recommendation like this, just to see where the numbers were. It's probably the same thing that's going to happen with other events in the state. In terms of bars and restaurants, again, they are being encouraged to and actually are utilizing outdoor space. They've been told that one of the things that they're going to be asked to do is to keep people seated and 6 feet apart from everyone else. In many cases, we're talking about adults. One of the huge concerns, when we talk about higher education, is when all of these students come from other places into college towns. And we get what we get with what happened at the University of Louisville with the athletes. All of them are tested regularly. All of them are, taking part in workouts and their health is monitored. They're regularly tested. And then they go to an off-campus party and boom, 4 of the sports at U of L are impacted. As students return to college, that's a huge concern. That they would be doing things like that off campus. And so again, I'll go back to another point I made already, which is, being able to monitor and do what's best for kids in a classroom in a school is very different than a social setting. Those are not equivalents. And so, it's one of those things where when we think about this, we have to think about it in terms of kindergartners all the way up to seniors in high school and what that looks like and how that can be done.
Okay. The next question is, where do we stand on athletics? It's not a good look to have sports occurring when we can't have in-person classes.
I know, and Lieutenant Governor may want to comment. I know conversations have, or I believe there was a meeting today between KHSAA, Commissioner Tackett, and Lieutenant Governor and others in the governor's office. It's my understanding that Commissioner Tackett and KHSAA have multiple scenarios in hand, knowing how the virus could change over the course of this next school year. Also understand that, of course, the KHSAA is governed by the Board of Control, and their meeting is August 20th, I believe. And so changes to that current scenario that we're in, and it's largely running parallel to what schools are looking like, will be made at that August 20th Board of Control meeting. Lieutenant Governor, is that a fair summary?
Yes, it is. And so I will say that I did meet with Commissioner Tackett this morning, and the senior advisor, Rocky Atkins, was with us as well. And we we were glad to know that the KHSAA has created several alternative sports calendars in the event that they would need them for different scenarios at different times. And so we're reviewing those. Going to take those to the governor and talk about what the best case scenario would be to move forward. But, you know, athletics push their start dates back as well. The thing that I'm concerned about, and I think Commissioner Tackett shared a concern with us this morning too, is sports that take place beyond school sports. Our travel teams and AAU and all of that kind of stuff that all of our kids participate in. I mean, you guys remember I'm a coach. My husband's a coach currently. We have a college freshman and a high school senior basketball players. And Emma, who's my adopted daughter, is literally waiting to find out if there's going to be a professional league in Europe because she has a spot on a team if there is. So you want to talk about being concerned about how these things are going to move forward. I promise you, I'm as worried as you are. So I know the KHSA has pushed back their start dates. They're also worried about competing with out of school sports. They have alternatives that are that they have prepared that the governor will review and will work and advise each other on how to move forward on that. So nothing is set in stone yet. And again, situations continue to roll and change. And so we're trying to be as flexible as we can and wait as long as we can to see where situations are without pushing it too far back. So I would say that, Kevin.
Thank you.
Okay. The next question is, will the governor's recommendation be applied to the state-operated ATCs, or will their operation be based on local districts?
Well, that's an interesting question because right now I'm operating from the belief that we will have all 171 districts not returning to in-person classes until September 28th. So if that's the case, then, you know, we will be operating under the based on that scenario. David Horseman, is that something you want to comment on as far as how? And I know we're trying to meet districts where they are and already are obviously, even if when we get to September 28th, there are going to be varying scenarios going on, and not every district may come into in person on September 28th. And how we will be dealing with that. Let's just expand that question to that.
I'm not sure if David's on, or he might be on mute. We can come back.
Yeah, let's come back to that, flag that, and if someone can flag David, he may be on another meeting.
Okay. So the next question, just wondering about how the recommendation is for schools not to be reopened to in-person classes when every county in Kentucky is below 5%, except for only 3 counties in the state. And then there's also a question later on that kind of goes with this, wanting to know where they can get a copy of the county positivity rates.
Well, I think if you can prove that there's not a student or an adult that comes to your county from another county to work or to go to school in your community, that would be a different kind of question. But as Commissioner Brown said earlier, we operate in a state where we cross county lines all the time, mainly for work and in some cases even for school. And so I think the governor even made the point yesterday on the press conference that it might even be better to look at it from a regional perspective than just a county perspective because of all of the inter-county travel that happens.
Okay. The next question I have is going on, can we please clarify the guidelines around the size of gatherings? We had been limited to 50 or fewer, but the governor said yesterday 10 or fewer. I thought that was for social gatherings and homes and businesses and schools could use the 50 number.
The governor's comment about 10 or fewer is talking about when you are in not a complete virtual scenario and you're not going back to in-person classes, an exception for bringing around 10 or 12 or 10 or fewer, however we define it, students back into the school setting for various reasons, such as, and he used the example of getting your Chromebook, which is a good example, particularly for students that may be new to the district or new to Kentucky, and then getting some orientation materials, those types of things. And so that is something that we're going to be working with public health to carve out. What does that look like? It's not designed to be divide a school of 200 by 10 and have 20 pods and come back every day. It's designed to be for specific purposes. It's designed to be, and so superintendent I talked with today, talking about how they could utilize that flexibility to bring students in for social emotional support, counseling, other reasons we may need to bring students in, and not to mention the Chromebook example. And so that is what that is for. The 10 person or less on the other side of that several weeks ago is designed for social gatherings at your home, not gatherings that are regulated by business or government and you're a governmental entity. This is a separate 10 person type rule that the governor was talking about that we are going to be working with public health to flesh that guidance out for you, and we'll then update the Healthy at School guidance with that.
And let me elaborate on the home versus business scenario. What we have found is the case, and I can plead guilty to this as well in the past. When you are out in a place of business, usually people are supposed to have on masks. Most of them do. Some people don't. But you're much more conscious of keeping a distance, wearing a mask, those types of things. When you are at your home and you have family and or friends over, you just assume that everybody's safe and healthy and everything's fine. You might not wear a mask. You might be closer than you need to because you let your guard down and it's comfortable. And so that's the reason for that. Whereas if you are out at a place of business, they are supposed to be following the guidelines and implementing those guidelines in order to be able to stay open and to keep people safe. What you saw, I think at a picture of a bar that led to concern about having to close bars down and take restaurants down to a smaller percentage. That's a nationwide issue. That recommendation came from the White House. It wasn't something that, just came from, this administration. And so, again, letting your guard down around people that you're familiar with in your bubble is a different thing in your backyard than going out to a public venue where there should be guidelines being followed, and it's visible and easy to see that people have on masks and keep distance.
Okay. The next question that we have is they were wanting to know if there was an acceptable number of students to report for in person, or I guess I don't know if it's students or if it means employees, since we've it's already been talked about September 28th, but the governor had talked about sharing that engaging small groups is encouraged, or perhaps this goes to working with the small groups of students. I think the question's a little disjointed. So I think this is if the students are brought in small groups. Kevin, I think we talked about this yesterday prior a little bit. Is there an acceptable number of students to report for in person?
Well, I think, yeah, and there may be two issues going on. If you're talking about in person during complete NTI before September 28th.
I believe that's where they're going.
That would be limited to around 10 students, as the governor talked about yesterday. That there's already preliminary discussions with public health determining that non-repetitive type events like that would be okay. We're going to explore with public health for a limited number of students for limited reasons. We're going to explore with public health this week because of this as to how far that can go. And what that looks like, so we can provide you additional examples other than the one that we've been using, which is the Chromebook example. The other thing, though, there are problems with this. So if you do, or you're all NTI, but you do want to bring some students in, you have to recognize that you will have teachers there, presumably for some of these activities, if you're bringing a small group in, but also that teacher may also be assigned to be doing virtual learning. And so you may have some staffing issues. So there are all those things to keep in mind. And also equity. We want to make sure if we're bringing some students in, we're not excluding others for similar needs. So all of that's going to have to be dealt with there and addressed at the local level.
Okay. Another question. They're wanting, again, just regional metrics so they can work as regions towards meeting schools to open. They feel like this would motivate people to follow the rules. Going to the next question. Please clarify expectations for staff coming in person to our school buildings during NTI.
And Lieutenant Gurley may want to follow up after me, but the governor has addressed this several times. I think the lieutenant governor has addressed this. The overall goal is to reduce the capacity of your buildings whenever possible so that you reduce the amount of people that might normally be there, to increase the ability to social distance and thus decreasing the risk of getting the virus. And so even if at your central office, even if you have a small central office and you have at least maybe one or two employees that all of their duties could be performed virtually, best case scenario is you allow those two employees to work virtually if they have the equipment to do so and can take that home. That decreases your central office capacity by 2. And you can, those remaining can then spread out and you have greater social distancing. That's what all businesses are trying to do. That's what we're doing at the department. And so we want you to strive to do that. Now, when we get back to in-person classes, you can't have in-person classes unless people are there. We understand that. However, while we're doing virtual, there has been somewhat of a debate over whether teachers should be made to come into the building or not. And we've still given the same response. It was consistent with the governors that you always need to look for ways where it is not necessary for someone to come into a congregate setting. Certainly not everybody coming in like you did opening day last year in the auditorium. We all know that's off the table. I heard a plan from a superintendent that we really need to bring actually 2 superintendents this week, and they checked this with me. We really need to bring our teachers in for a day or 2 at the very beginning. We think it's essential to kicking off non-traditional instruction, but we've already got them divided up. They will never meet all together. There are groups of 25 in pods. They will never cross pods. I think that's an acceptable plan. There have been other scenarios suggested that all teachers are being made to come into their classroom to teach virtually. That's not really necessary. And so I would discourage that. There may be some reasons for that, though. If Mr. Brown doesn't have a good connection in teaching virtually at home, and Mr. Brown needs to be in his classroom to get the district's connection to be able to teach virtually, obviously that should be permitted. But what the governor was saying is, please don't just have people in buildings like we would normally have them outside of a pandemic. Follow healthy at work, always strive to reduce those capacities and increase social distancing. Lieutenant Governor, you may have more to add, more detail to add to that.
Okay. And I will tell you, I met with a group of superintendents who asked for county metrics. And I took that to the Department of Public Health, and they said that they did not believe that that was. Oh, speaking of the devil, Connie White is in the lobby. Looky there.
She did that earlier.
Yeah. Dr. White, if you're watching, I was just talking about you, and here you are. I took the request for that some of the superintendents made for being able to use county metrics to determine whether or not they could reopen their school or to in person or vice versa. I took that to the Department of Public Health. They did not believe that numbers at that level would be reliable, and I'll let Dr. White elaborate on that in just a second because she's a doctor and I'm not. But what I can do, and I'm doing right now because she's here, is have a discussion with them about the potential to regionalize those metrics, and we'll see if there's a way that we can look at that. And so I will take that to them, and I'll have that meeting again from a regional perspective. But in terms of teachers going into the building, there's two ways I think about this. We are constantly being asked to innovate and do things differently and think better and be more efficient. And I don't know how we can say that we would trust kids to do work at home, but we don't trust our teachers to do work at home, first of all. Second of all, the other argument I hear is, well, why can't teachers just come to school and work in their classroom? But why is that necessary? If all they're going to do is walk in the building and walk to their classroom and deliver instruction, then why the hassle? Why would we not make this as efficient as possible? And so I would just say that when there are times, like Commissioner Brown mentioned, that it could be necessary, and we certainly respect that and trust you to act in good faith. But in terms of a mandate or anything like that, I think I would, just step back and think about what makes sense, because the ways of old are gone at this point, and we've got to start utilizing the tools that we have to be more effective and efficient.
Thank you. And Tony, I believe David Horseman is on if you want to ask the ATC question again, and then David, I'll kick it off and then kick it over to you.
Okay. So the question was, will the governor's recommendation be applied to state-operated ATCs, or will their operation be based on local districts?
So David, before you answer, first of all, the ATCs and the Kentucky School for the Deaf and the Kentucky School for the Blind will be following the governor's recommendation. However, what I'm asking David to comment on is obviously operating virtually and having schools, some schools starting and feeder schools into our ACT, some starting, some not starting virtually, how we're going to handle that virtually at the ATCs. Can you talk about that, David?
Yes, well, we've been preparing for multiple scenarios where we have one district that's virtual, one district that's in person, and if the district, if we are allowed in person at the time, we will serve those districts that are in person. If we happen to be in a district that is closed, their buildings are closed, then we would have to handle the feeder districts virtually because of the closing of the center. But we plan to serve the students in whatever capacity that their district allows them to, and that we're allowed to operate. And we've done a lot this summer in trying to prepare for having more opportunities for hands-on, not to replace, but to enhance the virtual instruction that we have coming up this fall.
Okay.
Tony, thank you, David. Tony, let's do one more, and then we will go to our agenda items. And then that will still leave time for questions at the end.
Okay. They said that they just need help, superintendents, and this is liked by eight others. We need help from the governor and the commissioner to let the public know that there will be consequences for not adhering. This is more than a simple recommendation. Please help with this. So I don't know if that's just a statement, or I know that you've addressed it.
I listed various consequences that are available under law. I can't speak for public health, and I can't speak for for the governor's office as to what they might implement. We will first of all, we're going to begin our consequences by talking and having a very frank discussion to try to get the issue worked out if a district were not to decide not to abide by the recommendation. And then we will take it from there. If for whatever reason the agencies decide not to take action that statutes may allow them, including the department, and the district goes on, there will be consequences. There will be consequences there locally. There's a segment that will be happy. There will be another segment that will be very scared about going in, and we don't want to see it, but there could very well be virus spread as a result, and so there will be consequences. If there is a case increase, then that takes us back up to the other option. So if you decide to open and we don't do anything until you open, and then there are cases, we still have all those other avenues available, such as the state board's executive emergency authority, the governor's executive order, and the orders by public health. And that's what the public health authority was designed for situations like this.
So, Tony, can you say that again? Was it they're asking for support in this message?
Yes, just wanting to, they're wanting to just have support from the governor's office and the commissioner's officers in terms of ramifications if they don't follow the guidelines or. We need help from the governor and the commissioner to let the public know that there will be consequences for not adhering. This is more than a simple recommendation. Will this happen?
Okay. Well, I would say that's probably a question for the governor, and I can probably answer on his behalf a little bit here. But I think that he has been very clear about the fact that he's looking out for the well-being of specifically the faculty and staff in our school buildings. If there is any support for public education, you're not going to find a group of people who are more dedicated to that outside of this administration and the Department of Education. You're just not. If there was any way that we could wave a magic wand and make a bubble over this state and be able to return to normalcy, you best believe that we would do it. We want our kids back in school. We want them playing sports. We want to be able to do things that we've normally done. None of this is ideal. None of it's convenient. And none of it is anything that we want to happen. A lot of this has been, because it's coming from the governor, a lot of things get politicized. And I'm a firm believer that you shouldn't and we can't afford to politicize public education. We just can't. And every decision that we've made has been based on the health and safety of the people in the school buildings. You will never find people who are more supportive of our education community than this administration and the department. And so we'll continue to operate that way and do the best that we can. I've listened to you all. Every time my phone rings or I get a text, I hear you. I even met with a group of superintendents that said they just wanted to shoot somebody straight. And I'm a straight shooter and I'm happy to do that. And we'll continue to do that. And so I trust you. I trust your district. I trust the teachers in your classrooms to do the best that they can. And it's because of that I have a hard time thinking that the people that we trust that much should be asked to do something as dangerous as return to groups of people inside of a building all day, every day at the peak of a pandemic. That's just how we feel at this point. One note before I leave, I want you all to know that I pulled together the Finance Cabinet, the Budget Office, the Commonwealth Office of Technology, and the Education Cabinet to work on figuring out both a short-term and a long-term support for Wi-Fi, hotspots, connectivity, whatever you want to call it, across Kentucky. We're working on that diligently at this point and bringing all of the people together we can to find solutions and to be able to make that happen. We're also looking at ways we can support the food service that will have to continue through your schools. You did a phenomenal job of continuing to serve our communities and the kids that are in most need in your communities, and I thank you for that in the spring. And so the support is there. I promise you we're working on figuring out how to make a bad situation better. And so we'll continue to do that. And you all know what a great partner Interim Commissioner Brown has been in this endeavor, and we'll continue to work together to get through this.
All right. Do you have time for another question, or do you need to hop off?
We can take one more. Depends on what it is. I'm just kidding.
Well, you can always just give it to Kevin. So this is pertaining to universities. There are at least 20,000 university. Oh, it just jumped. Where did it go? 20,000 university students returning to campus, two campuses within our school district at WKU. How are universities being able to open and K-12 districts like Bowling Green independent school districts are not?
And that's a huge concern. Like I just said, we have an incoming freshman in college. He is supposed to move in next weekend, and I don't know how that happens. Tony and I actually just texted about this the other day because she has a son who's going to college too. I don't know how it happens in a safe way. I worry about the communities like Bowling Green that all of these students are coming back to. I will say again, we've got to go back to higher education. Even though it's education, is different than a kindergarten setting or a second grade setting in a school building. So they have different. They don't have any less concerns. They have different concerns. And I've been working with Aaron Thompson, the president of CPE, on helping to kind of work through some of those things as well. But many universities have actually delayed the start of school in person to try to get through the fall and then to see where they are. And I know that's been a decision of many. And I want you all to also realize, and I know you realize this, but we're also focused on what's right in front of us and what our household is like, what our place of work is like. Every single state in the country has pushed back. They have either pushed back in-person classes, or they've agreed to start digitally, all of them. So this is not just a Kentucky thing. This is not just a Governor Beshear thing. This is truly a national issue, and we are not the only ones dealing with this. And frankly, every state in the country is having to figure out how to deal with it. And we're all pretty much landing in the same place, which is push back the start of in-person classes, start digitally. All 50 states are doing that. And so we'll continue to watch and see where other states who, they push back their start date, but not very far, see how those end up working out. And we'll have to learn from mistakes and make sure we don't make the same ones that other states do.
Okay. All right. Thank you very much for taking the time to join us today.
All right. I appreciate it.
Governor, we're going to go to the communication update at the very end before question and answer, and we want to be respectful of the Kentucky Department of Behavioral Health staff, their time. They're here with us today to talk about suicide prevention training during the time of COVID. I've heard from several superintendents, one this morning, We had a very difficult conversation over 2 suicides in her community, and this is very timely, and we all need to pay attention to this. And I will just go ahead and note we are not waiving the September 15th statutory deadline. There are ways to get this training, as you will hear, out to your students virtually. And if we don't do any training this semester, we need to do this one because it can literally save a life. So I'll turn it over to Patty Clark, Becky Whipple, and Kathy Prothero, and Laura Edwards.
So good afternoon, everybody. I'm Patty Clark. I'm the program manager for prevention and promotion in the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. Such a long title, right? I oversee the substance use and suicide prevention for Kentucky and provide a lot of resources that you guys may have used in your schools. The research that I have done really focuses on the intersection between school safety and suicide and substance use. And so this really aligns with our conversation that we've been having this afternoon about thinking about school safety and student safety as we head back into the classroom virtually, of course. This afternoon, I'm here with State Suicide Prevention Coordinator Beck Whipple to offer some recommendations on ways that you can meet that legislative mandate that Commissioner Brown indicated is not going to be waived at this point. As we get started, I really want to point out that we will be talking about suicide, and I invite you to do a body scan to ensure that you're in a safe place for this discussion. I invite you to take care of yourself and to keep yourself safe. And you know, this is a similar thing that I encourage you to do with your students as you have these conversations. So we've heard from many of you, many of your schools related to questions about how to do suicide prevention, and even if you should continue to do that in light of our current situations. But based on our current understanding of the mental health issues among your youth, providing suicide prevention information at this time is vital to ensure that kids feel safe this fall. There are lots of reasons that the global pandemic may actually influence suicide risk and increase the risks that they have of dying by suicide. As a result, schools should operate on the assumption that everyone, your students, your families, and your staff will have experienced some degree of anxiety and stress, uncertainty, illness, grief, and loss in this time. The experience of social distancing and being home during the COVID-19 may have been traumatic for some. Some may have been ill themselves. They may be grieving the loss of a relative or a friend. They may have experienced hunger, abuse, neglect, evictions, domestic violence, or even community violence in this time. The need for physical distancing may also increase the sense of social isolation. And then uncertainty about the circumstances of the pandemic, knowing whether they're going back to school or not, may also generate worry and fear about their future. We also see existing disparities among those students who are most vulnerable, potentially being pronounced as well. So some of the reasons that we really, really recommend that we move forward with providing suicide prevention activities. So most of you probably remember Maslow's hierarchy of needs. Safety is the foundation of that triangle, and ensuring that safety is imperative in this time. All right, can you flip the slide, please? Thank you. So even without the added stressors of COVID, students who perceive school as not a safe place have an increased likelihood of also reporting suicidal behavior. Among Kentucky middle and high school students, 14.6%, nearly 15% of students say they felt unsafe or very unsafe at school. And those who feel unsafe are 4 times more likely to attempt suicide. In Kentucky in 2019, suicide was the leading cause of death for youth ages 10 to 14, and the second leading cause among those ages 15 to 34. These data highlight the importance of addressing suicide as students head back to school. Youth who feel safe are more likely to achieve academically, and helping students feel safe at school should be your priority. So Beck is going to walk us through the recommendations for trainings for this coming semester. Beck?
Thanks, Patty. Yeah, next slide, please. Oh, yeah, you got it, the right one. So yeah, this is the actual Kentucky state statute as it applies right now. We are recommending that we do keep the September 5th deadline, but really change and tailor the training or the awareness in a different way. Folks last year and the year before, since the legislation has passed, have used really great, nationally recognized evidence-based programs, and we're going to continue that. But in this first, before September 15th, we're really going to try to change the setup to more of a prevention to kind of an intervention model of suicide awareness. So it's really going to take and scale up what clinicians use on an individual level and scale that up to a district. So you can look at Stanley and Brown have a safety planning template that you can look at, and then just think scale up. How do I do this for our district? How do I do this for our kids and our students and the teachers and staff? So the change and the kind of the focus in our presentation and what's going to be available, Patty's going to talk about this next, is that we want to really focus our kids on, building that internal coping strategies, building that resiliency, tapping into community resiliency, all of those. We also want to make sure that we are giving very clear guidelines, clear avenues of support to a trusted adult. Kids having a trusted adult that they can talk to about their mental health concerns or, thoughts or behaviors of suicide is one of the biggest things that we can provide. So making sure that your districts have very clear virtual avenues of how to get support when they're needing it, kind of virtual hallways or virtual counselors' offices, and making sure that, those pathways are reviewed age appropriate, obviously, for each of the kids in your schools. We want to, make sure that they're having folks that they recognize, that they can identify. I loved what Commissioner was discussed earlier about bringing new kids in to do kind of an intro to staff. And that's a possibility that might help kind of create faces or names that they can come to if they're in distress and they're new, or it's a transitional age, like a 6th grade or something like that. We also want to, just kind of make sure that there's delivery of that clear avenue of support. So we're kind of moving from prevention, where we're looking at warning signs and all of that, to looking at actual plans, safety planning, and doing that on a district level, classroom level, in a virtual format. So I'll turn it back over to Patty to talk about one specific instrument or tool that you can use within your schools.
So thanks, Beck. Can you flip it forward a couple more slides? And I do believe you guys will receive these slides so that you have this information as well. Yeah, so we're going to talk about one option that we've had the opportunity to partner with in anticipation of not being able to go back to school in-person classrooms. Earlier this summer, I met with National Suicide Prevention expert Marion Underwood and her team at the Society for the Prevention of Teen Suicide. Many of you have utilized the Lifelines prevention, intervention, and postvention materials in the past for your suicide prevention delivery. And Marion was the co-developer of Lifeline and has a long time experience working in and with schools addressing suicidal behavior. And so at that time, the Society for the Prevention of Teen Suicide was in the process of developing a developmentally appropriate set of videos that address heading back to school, but also doing that in a way that acknowledges the grief and loss that students are experiencing as a result of the trauma of COVID-19. We had the chance and some extra money to be able to partner with the society at that time. And so we were able to expand on the offerings that they are able to, that they were planning to provide in this video series. So now we have videos for high school students, a separate middle school student video, as well as videos for upper and lower elementary school, since the impacts of COVID-19 don't start with students in the middle school. While it's important to acknowledge that elementary students are not required to receive suicide prevention information, Suicide deaths have been noted in children as young as 8, and we are seeing more and more elementary students who are presenting with suicide ideation. So these videos for elementary do not address suicide. They really look at resilience and coping skills and acknowledging the feelings that students of all ages are having in this time and ways to move through those. In addition, they are writing specifically for Kentucky a discussion guide that can be utilized along with the videos for students that increase the safety of our students and also support your schools in meeting the requirements of the legislative mandated. The videos are online now, and the discussion guide will be provided to you guys no later than August 15th. In addition to that, the series has a parent video, and we are recommending that you're pushing that link out to your parents ahead of time prior to training your students, because those parents are going to be with those kids much more than they may be with their teachers, and just helping parents recognize that they may see changes in their child that could potentially point to suicidal behavior. One of the good things about this is they are free. All these materials will be free to all schools. And as I mentioned, the video is online at this point. So if you could flip the slide for me. We are recommending that schools consider providing a booster training in January or whenever we head back to school in person. We believe that by then that a suicide prevention curriculum, such as those used in the past, could be used again, and just giving a booster session would be ideal for students at that time. There are a number of curricula that are available: Lifeline, Signs of Suicide, More Than Sad. There's also a Kentucky-produced offering that's going to be released through KET in October that may be an option. We do have some subscriptions available for the Lifelines. If that's something that you're interested in, please be sure to send me an email. They have modules for 5th through 6th grades, 7th through 10th grades, as well as 11th and 12th grades, and those have been recently updated. When it comes to the future suicide trainings for students, we have created a Good, Better, Best document that guides your selection of the components that should be included. Just a reminder, it is really the components that make the suicide prevention piece most effective. It's the layering of the pieces as you consider implementing those curriculum that makes a difference for our students. We do not recommend that you have assemblies or videos that have not been vetted for safe messaging and safety. You can flip the slides, please. Assemblies make it difficult to identify when students are triggered during a session. Smaller groups are much better for allowing a closer visualization of students during these sessions. And often videos from the internet may include components that are triggering for a student with individual trauma, especially those that may tell the story of survivors. So our team would be glad to give a look at if you want to use something different when we get to in-person time to make sure that it meets our safe messaging requirements. So now I'm going to hand it back to talk about some options for staff training as well.
Yeah, so a part of our recommendation is that no student.
Did we lose you?
Looks like we've lost Beck. There we go.
Sorry. Yeah, I don't know where you all lost me, but yeah, that all school staff are trained prior to doing any suicide prevention or awareness training with the students. We do have recommendations on the Good, Better, Best documents, and those are all still applicable for this time period and can be done virtually. Just making sure that component of reviewing your district policies and procedures is kind of the most important part of making sure that everyone is on the same page, whether that be food services, bus drivers, school, teachers, friskies, whoever, that everybody's on the same page as far as, kind of what the plan is moving forward. If you could go to the next one, that's pretty much what this slide says. It's kind of the good, better, best of making sure that that everybody's on the same page, and that you're doing evidence-based prevention work, but you're couching it within your local procedure, so that, we're closing the gap. The next slide, please. Let's see where we're at. So we do have back to the navigating back to school in the society. I just took these trainings yesterday and learned some things myself. So some of these options also are for middle and high school certified staff, as well as classified staff videos, like Patty mentioned. Really talks and test your competencies, gives you real life scenarios. There's students involved. And so, like Patty also mentioned, these are all free for school districts to use. So you can go to the next one. I'll send it back over to Patty.
All right, so we just want to remind you that even if your school has already completed your staff training this year, we encourage you to share the staff videos in the navigating series before you provide that information to students, just as a good reminder for them to recognize the potential anxiety that students are feeling in this time, and really be ready to address that when they provide the suicide prevention information. I also want to introduce you to the Kentucky's Regional Prevention Center system. Every county in Kentucky is covered by an RPC, which are connected to the Community Mental Health Center serving your county. Prevention specialists in each RPC are equipped to support your school in planning for student and staff suicide prevention trainings. A complete list of the centers, as well as the contact informations, are included in that Good, Better, Best document that you would have received in the Monday message from Commissioner Brown. The materials are also available on the KDE website as well. And so we just want to thank you for your time this afternoon. We also encourage you to reach out to either Beck or I. Our email addresses are on this last slide. We're here to support you, to help make sure that you have the resources you need to be able to address suicide prevention for your students, and really just recognizing how important this suicide prevention information in this time is going to go to addressing this perception of safety that students have as they head back to school as well. So I just want to thank you guys, and again, don't hesitate to reach out if you have additional questions. Thank you.
Patty and Beck,
Yes.
Thank you. We noticed the information there, superintendents and others, to ask a question to Ms. Clark. Tony, any questions that you know of now related to this presentation?
I'm going to check the soapbox. Give me 1 second here. There's quite a few questions. So are we potentially providing suicide prevention training for students when they are off campus and could be in a non-safe place? They're asking to extend the deadline for this so that we can provide in-person training for kids.
Well, I'll defer to our behavioral health experts on the rest of that answer, but unless the experts tell me otherwise, delaying the training until we get to in-person is potentially not putting information in the hands of children that may need it to prevent a suicide, even though it may not be delivered in an ideal circumstance. That's my position as commissioner, unless I'm told otherwise through behavioral health.
That's absolutely correct. We definitely encourage you to consider utilizing these videos as a way to have a conversation either in your virtual classrooms with the discussion guides. We do offer some recommendations that if you're doing a virtual training with students, that you have somebody who's watching your chat, that if you have kids who are off camera, that somebody's touching bases with them to make sure that they are safe in this time frame. It's just so important because we've seen in many the Pritchard Committee's youth voice team has conducted surveys, and our youth are telling us that they're feeling anxious. We're hearing the reports of deaths of students, and it's just vital that we have this conversation, but we also need to make sure that we're putting those safeguards in place as we do that work. And if you want to have some conversations about what that can look like, please don't hesitate to reach out to either Beck or I, and we'll be glad to provide some additional support.
And I definitely, highly recommend, using the opportunity that this creates to engage parents in a different way. Because all of these QPR trainings and all of this materials can be done online. I know that the virtual platform is a privilege, and not all folks have access. But I do want to, encourage folks to reach out to parents and get parents engaged. And obviously, we wouldn't recommend doing any virtual trainings about suicide before letting parents know well ahead of time, so that they can make arrangements to be nearby. So really, it is a lot more preparation that has to happen in order for this to happen. But I think it's already being done in lots of different ways. And so to kind of just continue to collaborate and make sure that it's a unified message from the schools, from behavioral health, the parents, to even our public health partners have done such a great job of advocating mental health wellness. And so I think it is tricky, but I think it can be done and is important.
I also think too, that's the reason that we're offering this updated guidance, that we're moving away from a prevention model, which really focuses on kids being gatekeepers for their friends and family members, and more into that intervention model of that, creating that safety plan and making sure that they understand who they need to reach out to, that they have they've talked through coping skills, they know the crisis text line numbers. All of those things are part of a standard safety plan that you're doing as a way to keep those kids safe in this time as well, as opposed to just teaching them about the warning signs and the risk factors, and connecting them with adults as well.
And I would add, and Tony, if you want to just briefly summarize, but our Commissioner Student Advisory Council today had this presentation, and they confirmed everything that's been said here today by Beck and Patty. Tony, do you want to comment on that?
Yes. So one of the things that they did see a version of this presentation, and we do have representatives from across the state, and they did mention the fact that they don't necessarily think that the training needs to be delayed beyond the 15th of September, because it is so important, and because of the additional mental illness and stress that's coming on because of COVID-19. However, they did mention some of the concerns that are, and I'll bring up this question here next, about the virtual, how do you provide this training for students who may not have access? So there's a lot of issues to be weighed out here, but the students definitely believe that there needs to be maybe perhaps a better way at doing more to reach more students.
This is
which goes to the next question, which was, how do we provide suicide training for virtual students who have no device or internet?
Beck, do you want?
I think at that point, we'll have to reach out and we'll, kind of brainstorm some options to do that. I do think we can use our regional prevention centers and get to groups less than 10. We do have, trainers throughout the state that we could, utilize. I think it's going to require a little bit more training or a little bit more preparation, but we can offer that if folks are not able to access these virtual platforms or training.
Correct. Yeah, there's another comment here in the soapbox that just says that there's a lot of kids in their district that do not have home internet access, and they will not be able to share the videos or have small group virtual meetings. So just to mark that one off as well.
Yeah, and I think the discussion guides may be helpful in preparing some opportunities for them to reach out. Beck and I will do some resources and look and check for some handouts that could be utilized. I think part of it is really helping the kids figure out what their coping mechanisms are in that time frame, who they would reach out to, and making sure they have access to the crisis line numbers, and just helping them identify the feelings that they're having in this time frame. So, how are they going to deliver other classroom materials, and then thinking about how we adjust this for that as well.
Dr. Meserly, do you have a comment or a question?
Yes, I raised my hand virtually. Thank you so much. I was trying to be polite. Yes, I wanted to thank you so much to my partners from CHFS, from Behavioral Health, for being here today. I wanted to, from the public health aspect, I wanted to just highlight that ages 10 to 14, suicide is the second leading cause of death after unintentional injuries. That's accidents, drownings. So that's age 10 to 14. So this is, that's why their curriculum now for elementary, because suicides are happening as young as 10 years old. So I really do hope, and these statistics are before COVID-19.
Mm-hmm.
So I really do hope that all of you prioritize this education piece during this time of a pandemic, where children really need, and the parents really need to be supported to know how to deal with their children.
I think for us, it's just a global message of normalizing help seeking. None of us are okay right now. None of us are like at our full capacity and dealing with the pandemic and school, and and it's like, how can we model as adults? How can we model as professionals, normalizing that reaching out and normalizing that safety planning to because we all kind of need each other. So I really appreciate you saying that. And the difference between unintentional injury and suicide in 10 to 14 is minimal. So they're like neck and neck, which is frightening. And we're hearing, that students as young as 8 here know the word suicide. So I appreciate you saying that.
Okay. The next question that I see here is, what happens if a school district does not return to school at all until September 28th? How do they meet this mandate of September 15th?
They don't.
I'll speak first. So we want districts obviously to utilize the virtual options first, and that will reach the majority of the students. We know that. We know the statistics on that, and we know we can't reach all of them virtually or digitally, but we can reach the majority of them. And we want that effort obviously to be made. And then we will need to produce probably additional guidance in a written form from behavioral health, working with the department to get out to districts here in the next week or so to give you other options on how to communicate that, even if it's by mailing a document or that's approved by behavioral health or something else. I'm just throwing that out there.
Kevin, this is Kelly. Superintendent, if you are a district that plans not to do any type of virtual learning until the end of September, please shoot me an email, kelly.foster@education.ky.gov, and that way we'll make sure that we are contacting you to determine next steps.
Okay.
And we're devoting this more time than we probably had planned, because this is one of the most important issues out there for our kids and for our society. And so we want to make sure, Tony, this will be at the expense of maybe having to move some agenda items to next week's webcast, but this has been a good conversation. And if there are any other questions, let's go ahead and address them.
That's fine. And I think that the governor's press conference at 4 was also postponed today as well. So we might be able to go a little bit into 4 o'clock on some of the other ones. Just let me know. How do we document having had the suicide training with our students? And then the second part of that was, can they come in as small groups of 10 or less numerous times for those without internet? So I guess documentation is one thing, and then the small groups.
So we'll put that in our guidance that we're going to send out to all districts.
Okay.
And I believe that there's a certificate that you can like that you receive after you've completed the virtual. So students might be able to just forward that on as evidence that they received it. And the same for staff.
Okay. All right. I think that is all I see on this topic. I'm going to scroll through just in case I've missed anything. If anybody else sees anything that I've missed, if you're in the soapbox, let me know. But I think there's several others in here that are others. No, I think I think that's it for this topic.
Thank you all again. It's a great discussion, a very important topic, and we appreciate the partnership.
Thank you for allowing us to be here.
Thank
Please
you.
Please don't hesitate to let us know if we can help.
Thank you. So Tony, let's move to the next on the agenda, the new KDE guidance on library media centers. And I'm just going to ask the next two presenters, try to keep this to 10 minutes or maybe 15 at the max, just so we can, we want to try to get to at least everything, and including going over into past four a little bit on question and answer.
Absolutely. Thank you so much, Commissioner Brown. We will keep it as brief and as straight to the point as possible. We're excited to share a bit as questions have come in throughout the state. Mr. James Allen, who's our statewide library media lead, has pulled together and referencing some work from some other states, as well as our flagship guidance and contextualizing the guidance specifically for our library media centers and our library media leaders throughout the state. And so oftentimes, you know, we look at our library media centers as, in many of our schools, as our largest classroom. And so contextualizing the in-person guidance is really helpful. James is going to lead us through that, as these, the slides he'll share are really simply calling out some of the highlights of the guidance document that was released yesterday. But also want to point out that beyond in-person interactions in library media centers, there's also a ton of digital or virtual library types of experiences that our library media leaders can assist us with. So James, why don't you take it away, and let's be as straight to the point as possible.
Yeah, and similar to the guiding questions we have here, the considerations are kind of broken into three parts. It's what can the library staff do, and then kind of what more like specific cleaning type things you would do if we were in person. And then the last section is how a little bit more how the library media specialists, what they can provide to your staff and students during this time, regardless of whether you're in person or not. So we can go to the next slide. So these just kind of cover some things you've probably seen before, just following the guidelines that are already out, but may just be a little bit different for the library because it's just a larger space. All right, the next slide. There's some research out there that a group did that is really pretty good. This kind of talks about this. They took different surfaces. They actually did the research for libraries and museums, and they took different materials that you would find in those places and did tests to see how long the virus would last. And the longest was 4 days. So when I've been asked, I just feel to be safe, 4 or 5 days or a week is a good time limit to quarantine those items if they come back, if they're physical items. And just to point out, probably most of you know this, most of our libraries have online catalogs. So that kind of browsing can be done almost from anywhere, even at home. And that would just kind of decrease the time that you have to have groups of students together. I think we can go to the next one already. This part is really important. So our school librarians are, just like I'm on the team in the Office of Education Technology, librarians, we have over 1,000 of them in the state, and they are really often technology specialists also in education. So keep in mind that when we need high quality content, especially for not in-person teaching, your school librarian is a great person to reach out to for that kind of help. And we also have partners with KT. They provide PBS Learning Media to all of our schools for free. And it's tons of videos, lessons, articles, images. And then also KYVL is a subscription service, which also is used in public libraries. And most of our school districts have KYVL. And it's a consortium where you get access to multiple databases, ebooks and full text magazines and encyclopedias. And there's just no way any school district, regardless of the size, would be able to purchase all of those separate resources at a competitive cost compared to just subscribing to KYVL. So that's why we wanted to have that in here. And then just promoting ebook collections that you have on your own, audiobooks, and just making sure you're there for your teachers and students for that service. Right, for the next one. And this kind of is what I was talking about, the in-person and remote learning. Obviously, librarians are passionate about reading and passionate about our students becoming readers and loving to read. So making sure you have choices for your students that they're interested in. And I know a lot of librarians around the state right now are working on ways to, especially if we're not in person, maintaining that contact with students. I know in the spring things were a little bit difficult and we didn't want to bombard teachers and students, but trying to partner with teachers, co-teach like we normally would if we were in person, just trying to replicate that online as best we can and being available to our students and teachers whenever they have questions about anything. I think we have one more maybe. And this just kind of goes over some things that your school librarians can offer that you just may not think about. I've heard of a few schools already thinking about offering curbside pickup for physical materials, like some of our public libraries have been doing. And then just a reminder for your administrators and your teachers, use your school librarian, their information specialists, to help you curate those high quality digital content things for your, regardless of what content you're teaching. They're there to help you. They want to hear from you. They do not want to, like we were kind of saying about bombard people, they don't want to just send mass emails out to every teacher. They want to help you specifically. So include them in your online classes, make them a co-teacher, reach out to them to get their help. Marty, did you want to?
Yeah, I think in closing this section up, we released this guidance earlier in this week to help have a better conversation throughout the state. Kentucky is a state that all across the nation, if we look across the nation, we have a great representation of our library media leadership and a network that's developed. We have several associations in the state that have helped identify additional resources that our library media leaders can help with on a day-to-day basis. And then finally, what I would say is many schools and districts are partnering with public libraries locally, and we would highly recommend that. And we can, James can help facilitate that work as well. And so we just wanted to have one more nod to let us help through those resources as we move forward, especially during these uncertain times. And we know that library leaders can help push learning into new spaces for us. So Tony, we'll take it back to you for the next topic. Thanks, James, for joining us.
Yes, thank you all.
Thank you both. We will defer those questions that you may have regarding this presentation to the closing question and answer period. If you both can stay with us, we'll move along to virtual class size new guidance with Dr. Kelly Foster and Dr. Park.
Hi, good afternoon. This will just take a couple of minutes because we actually talked about this last week. Tony, if you can pull up the slides. We talked about this last week on the webcast, and two things that I want to touch on. The first being that if you are an A1 school that has a site-based council, and the majority of the A1 schools out there do, and you are concerned about exemptions for class sizes during virtual learning, that you need to look at your site-based decision-making policies and you can adjust those at the local level. Nothing needs to be submitted to KDE if your school has an SBDM. So look at your local policies, and also check to make sure that your local board doesn't have any specific policies around class size. Next slide, please. The next slide deals with schools. We have a handful of A1 schools that do not have SBDMs. Those schools typically tend to be K-12 schools. And also we have several A5 programs across the state that do not have site-based councils. So if you are an A5 program or an A1 school that does not have a site base, you will need to ask for an exemption if you feel like you need to increase your class size due to virtual learning. And if you need an exemption form, please send me an email and I will get that right back out to you. And that's really an update from where we were on that on last week. And at this time, I'll turn it over to Dr. Park, and he's going to give you some specifics around recommendations for virtual class sizes. Thank you.
Thank you so much, Dr. Foster. The guidance that is released this week is, again, really straight to the point. There's one edge of if you need to expand your class size, then there's a way to do that. And on the other edge, we're receiving questions, and we are helping many districts through that process of understanding what are the influencers in order that we should consider before we exceed that maximum class size. And so the recommendations that you'll find, again, it's a 2.5-page document, but we're going to push hard with you along the way to, as we always have and as you always have, to keep our students in the center of the discussion, to ensure that there is that high quality learning experience that's occurring. We know that the considerations are should include ideas such as many of you are already enlisting additional facilitators per course, and so that's absolutely one of those influencers that would help you make that decision to extend beyond the recommended maximum class size. Also, additional content coaches that join, or co-teachers that join, as James just mentioned, from our an example, our library media leaders. But also, if you're leveraging a platform and there are teacher-friendly features inside that platform that would help you during virtual instruction. And so I want to call out that the ideas around virtual teaching, virtual learning, in this case, and for some situations, there are students who will be engaged in a virtual academy or a virtual program that is absent or separated from traditional in-person classroom teachers. And that may have additional influencers, such as a platform that offers features that can help us extend beyond. But we want to understand the teacher capacity. This issue came up in our Kentucky Board of Education meeting last week, and we want to reference that clearly to dig into what the teacher capacity is. And if you can go to the final slide, Tony, just the final point about student-to-teacher interactions and teacher capacity, understanding that if the teacher capacity and the student interactions decrease, so the more students a teacher has, the interactions decrease, then that doesn't help us from a learning progression perspective, and so we want to call that out. In the guidance, you'll also see that there's some research reference, because again, we have received questions about what should we be considering as we start up a brand new virtual academy, for example, or an A5 virtual program. Several districts are on that path. And so the question is, what is our recommended target? And so the guidance does include some of that to help you think through that. And so thank you so much, Tony and Commissioner Brown. We'll toss it back. If there are any questions, we'll hit them at the end, I guess.
Okay, Tony, let's keep moving, and looks like we're getting back on schedule, and we'll take questions on all of the topics at the end. Let's go. Do you want to do the communication update, Tony? And then we'll go.
I sure can. See if my superintendent friend is still hanging with us in the leadership room here. Superintendent Sowers, are you here? May have to
I'm here. Can you hear me, Tony?
I can. Just wanted to make sure you were still hanging with us there.
Yes,
All right,
I'm here.
Thank you, sir. I'm going to call on you in just a second. I'm going to go
Okay.
back to my slides. And again, guys, I know the slides are a little out of order, but they're all there in your email. I wanted to just make sure that you have some resources at your fingertips, as always. So I'm going to share my screen. And we will share it from there. Oh, it doesn't look like it's sharing. Why it's not sharing? Of course, slides that don't want to work. Right, is it working?
Starting to come up.
Yeah, it's looking.
There,
it's just
there you
looking at the. I guess I'm gonna have to just go backwards. Sorry, guys. Okay, so going back, I just wanted to remind you that the Coverings for Kids starts today. I know that many of your districts have signed up for this already. As of today, we have kind of kept track. I sent you out a Google sheet last Friday. I believe we're at now 60 or 65 districts who have indicated that they are participating in this initiative. This is a great way to get your communities involved with donating some additional PPE that you might be in need of as your staff and students look to the possible return of schools. So be sure, if you did not get the information from me last week, please reach out to me. I know several of you all have coordinators, and please let me know how we can help you or how the First Lady's office can help you with this effort. The next slide. Just again, going through, remembering to show you where all of our guidance documents are. I'm not going to spend a lot of time on this, but I always put these in your slides because we always have questions as to where we can find guidance documents. We have updated those with the 2 guidance documents that we released yesterday on the Library Media Center and the virtual programs that we just went over on this webcast. Our FAQs have been updated as of yesterday. We have more than 800 questions that are in this document. This is a living document on our website. It's hyperlinked on there in the blue, and you can get to it at any time. So whether it's 3 o'clock in the morning or 3 o'clock in the afternoon, you can get there, and we update it with webcast questions, advisory group questions, and it's just a good resource to go to in case you aren't able to listen to an entire webcast. I want to give an opportunity to give a shout out to many of our districts because I've been watching over the last couple of weeks as you have been really doing remarkable jobs with the masking campaigns. And we know it's been very tough as you've been trying to figure out what to do and how to approach the situation that's really changes every day. So I wanted to just, and you'll see these on your slides, I wanted to take an opportunity to just give a couple of examples here. You'll see Trigg County Schools, Paris Independent Schools, Warren County, Floyd County. These are just great examples. There's some videos. If you go on to the particular slides, you'll see there's links to them. The Paris Independent one is adorable, very cute videos, just where you're preparing your communities for what's going to happen. And I think these are great examples of engaging your community, and we're definitely sharing them here at the Department of Education. Which leads me to my next guest, Superintendent Marion Sowers from Casey County Schools. I wanted to just share a few minutes with one of your colleagues to go over and really just talk about the 5 videos, and I'm not going to play them. If we had more time, I would play one of the videos. But I thought these were a really good example, and I'm not sure how much time it took, and that's why I wanted him to come on to really see and answer just a few questions on how they did the videos and how much time it took and maybe budget-wise, and just talk a little bit about that. So Superintendent Sowers, how long did it take you to do these videos, and why did you do them?
Okay, so actually, Tony, we filmed all of them in one day. So we were with the guy that we partnered with on this project, and he literally came one full day. We tried to visit. We have 5 schools. We visited each one to try to get each school in at least one video. Tried to use the staff that we had around and students that most of the students that you see in the films are children of staff members who were probably in the video, but we were able to film all of them in the same day, and then it took him about a week to turn around and get the videos back to us. And then the goal was to try to release one every day or every other day, leading up to our what we had hoped was face-to-face instruction on August 24th. But the information will still be applicable once we return.
Okay. Why was this something that you felt like you wanted to do for your families and your community?
Well, I think, Tony, one of the things I know that we, just like every district in the state, we've worked a lot of hours in the last few months to try to imagine and plan for what school was going to look like when we return. And so we created this tiered, leveled system, and it's good information. But then, of course, as you solve one issue, and then that creates another question. You answer one question, and it leads to another issue. So before long, we were quickly realizing that our reentry plan, it's about 9 to 10 pages, but it could have been 40 pages to try to get the logistic information out to everyone. So the old saying, a picture's worth 1,000 words. Myself and my director of programs, who's also my public relations person, Josh Blevins, he was instrumental in this. He wrote out all of the scripts and got the actors all lined up, and he was phenomenal on this project, and he's actually featured in most of them. But we wanted to just show sort of a sequence, chronological order of the day of what parents could expect, because they're hearing, oh, well, are you going to be masked or are you not going to be masked, and what does the bus look like, and so we just really wanted to kind of lay out the expectations and ease the fear. We're getting calls every day. I'm scared. I have this fear. I don't know what to do. I really want my kid in school, but I have this concern. So just listening to them of what are you most concerned about? So then we tried to make sure in our scripts that we were answering some of the fears that we had heard. So great feedback from our community. They've been very appreciative. It's interesting to look at the views. I mean, some of them I looked this morning, over 7,000 views. It is the best way to get the word out. Of course, we all have district websites and we have, different resources, but social media is the way to really get the word out.
Great. And I think that I really appreciate you taking the time. I know, obviously, like all of our superintendents, you're trying to do the very best for your students and your community. And if you don't mind, just kind of sticking online in case we have a couple of questions for maybe some other superintendents, in case they have questions on maybe how you did that. And obviously, I know they can reach out to you personally too. But yeah, and that, I think, absolutely. Thank you so much.
Okay.
And I believe that wraps up. I was just going to remind you all to tune in, but he has postponed his 4 p.m. for tomorrow. We did learn that it is there. He's going to have his press conferences on Wednesday and Thursday this week. So with that, Kevin, I will toss back to you while I look at the soapbox.
Thank you so much, and thank you, Superintendent Sowers, for that. And I know that will inspire others. I know there are other similar efforts going on across the state, and it's truly making a difference to when we do get back to in-person. And it's actually helping now, because it sends the message that even when they are out and about, that the students need to have their masks on. We will go ahead now and go to our friends from Public Health. This session always kind of blends in naturally to our general question and answer session. Dr. White, Dr. Meserly, do you all have any opening comments, or do you just want to go straight to questions?
We may want to start with the positivity rate. I know that the Lieutenant Governor kind of volleyed that to us. So I talked about this, I guess it was Monday on the call. I don't think we talked about it here. So if we have, I know one of the questions last week was, why did I say the same things over and over again? Because sometimes people just miss questions, and so they need to ask and be reminded. But the reason that we can't give you a county level positivity rate is because the way you do a positivity rate is you get your numerator is the number of positive cases you have, and your denominator is the number of cases total that have been done. In the state statute, it is required that laboratories and healthcare providers report positive tests to the state or local Department for Public Health with a list of certain diseases. And there is also a category called emerging diseases. And so that's how COVID-19 has become a required reporting project for all labs that are doing testing and all providers that are doing testing. Unfortunately, there is not a absolute law that says you also have to report how many cases how many times you've tested for this particular disease. That is critical for the denominator. I can tell you how many positives are in your county, but unless I know how many cases were done, how many tests were done in your county, the negatives and positives added together, I can't give you a positivity rate. So for the state of Kentucky, we have finally gotten some cooperation from all the laboratories that do testing in Kentucky. And every day they send us a survey that we send out to them. And it says, yesterday we did X number of positive COVID-19 tests, and then we did Y number of tests.
Uh-oh. Did we freeze?
Total for the citizens of Kentucky. So we can talk. Can you still hear me? Can you hear me now?
Yes.
Okay, so I turned my camera off because I think my Wi-Fi here where I am is not so hot. So we can tell you the positivity rate for the state of Kentucky because we know all the positives and we know all the testing that was done. But can I tell you what happened in Taylor County or in Franklin County? I don't know how many of those total tests that were done in Kentucky were done in those individual counties. So it's not that we're not willing to do a positivity rate. We don't have the data to do that. Now, there's a lot of work being done to try to figure out ways that we can electronically do that. And we're onboarding more and more of our laboratories onto the Kentucky Health Information Exchange. And if we can get a big enough volume of them reporting that way, then there would be an opportunity to try to do an individual county positivity rate. But as the data is reported to us at this point in time, there is no way that we can do that positivity rate. Now, there are other things that are available that can be looked at by county, and I don't know how many of you have gone to kycovid19.ky.gov. We do have maps that show every county, and if you hover over that county, you can see what your total case is, you can see what your total death rate is. So that's available, and you can also see what your rate of cases and your rate of death is. We also do a metric where we look at hospitalizations of every hospital in the state and ICU. So all of those things added together give us some idea, and we do kind of our own internal gauging of red, yellow, and green. But we do not have that right now. That's a project that's ongoing, but we don't have a red, yellow, and green way to do that at the current time. There are other places you can go. Harvard has done something under their globalpandemics.org, and I can send out to you where you can go look at that, where they do a daily new cases per 100,000 people in a 7-month moving average. I'll say that again, that's kind of a mouthful. So it's the daily new cases per 100,000 people in a 7-month moving average. They take their data from us and they do that calculation, and they do have red, orange, yellow, and green. And then they have some recommendations depending on that. Is that the end all be all? For you to say, oh, if we're at this number, we need to close schools, and if we're at this number, we're not. No, that's just one metric. So those are the things that are available to us. I'll go ahead and directly address, I know some questions that some of you have from what Dr. Stack mentioned yesterday about a map with red, yellow, and green counties on it. And let me explain what that is. This is a weekly communication that all of the state health officers in the country and all the governors get. It is a metric, and they in the state metric, they look at skilled nursing facilities. They look at the death rate, the case rate, the statewide positivity rate, and then put a color on the state. And then using the cases, as I just discussed that Harvard does, they also do a county rate. That's a product that's produced by the White House, and we're not able to share that with anyone because that's just what we've been told. And I double checked on that to be sure that that was not a shareable document, and it's not. But the data that they're using for that red, yellow, and green comes from the cases, and you can find that on our website, and you can also find that, as I said, on the Harvard's globalepidemics.org website that I have shared with some of the folks at KDE, and I'm sure they can share that out with you folks if that would be helpful. That's a lot to say at the beginning. Now I'll stop and answer questions. I'm sorry.
Thank you. Even though it's may not be the answer some want, it's a good answer, and I appreciate the detail and the explanation.
Okay.
Tony, any related questions?
Yeah. I'm trying to put them all together because there's lots about just wanting to know about, the hot counties mentioned from the Trump report, the Trump counties, and then why they can't see which counties they are. Like, how can we call off schools in counties when we have no access to the positivity rates? How can we get the list of the hot list of 53 counties? So I'm not sure. I'm just trying to address some of these.
Right, and I think I answered the about the list, but you can go and you can hover over there's a map on our COVID website that you can hover over every county, and you can get your positivity, not your positivity rate, your rate of cases, your rate of deaths. You can get those. Now, what might be helpful is if your health department can help you with the trend line. That's something that I'm hoping to work on for every county, that you'll be able to also, when you hover over that county, see a trend line for that county. And we don't have that developed yet. Some of the local health departments will have that at their fingertips. Not everyone does. It depends on how many cases they've had. And when you've spent all of your time trying to do contact tracing, you probably haven't done all of that more detailed statistical analysis.
Okay, and then a question is, if the positivity rate is the quote unquote metric, then they said that they need that information.
Well, nobody said the positivity rate was the quote unquote metric. I'm just saying that that's what we can do as the state. And I think I've explained how it's not humanly possible to do county positivity rates because we don't know where all these tests have been done at this time, the way it's being reported to us. That's good. It's a good metric, but it's not the only one.
But part of the metric, and correct me if I'm wrong, Dr. White or Dr. Meserly, part of the metric is the state positivity rate being where it is, combined with the fact, as we discussed earlier, of all the other factors going on in Kentucky, the anecdotal information that we know people are going out of state to hot spots, the fact that we, for worship, for commerce, for other reasons, we go back and forth from community to community, county to county, area to area. All of those things working together, those four things, that's included in those four things, brought the governor to the point where this recommendation was required to delay the in-person. So that's where that positivity rate is a partial factor in that recommendation.
That's absolutely correct, Commissioner. You could have one county who has a very low positivity rate, but if you're surrounded by counties that have a high rate, or you have 3 families go on some big family vacations, which happened in one of our Eastern Kentucky counties, they went from 9 cases to about 72 cases in a couple of weeks. A couple of birthday parties and 1 church revival, and they were up to about 73 cases. So it can happen so very quickly with this disease. If there is an opportunity, and we certainly will work on that to get county positivity rates and more granular detailed data, that's something we're working on. Right now, we are hiring more people. We've got more epidemiologists than we've ever had who are learning how to do the work at the state, and we are hoping to continue to give more and more information as it's able to be calculated for everyone in the state.
Okay. All right. The next question is looking for NTI. I'm looking for just health department questions here. There's a lot of NTI questions. So
could I ask a question? I know we talked about the suicide training has to be done by a certain date, and since Dr. Messerly is in charge of immunizations, I wanted to give her a chance to shout out about how important it is to get our immunizations done by this fall as well.
Okay. Yes, go ahead.
Yes, thank you so much, Dr. White, for that opportunity. Yes, we've received some messaging that people are asking if immunizations are still required for school entry, although school is virtual. We are not changing those requirements because we have vaccines to prevent many, many diseases. We don't have one for COVID-19 yet. When we do, my department will be deploying that all across the state. But every other vaccine, specifically the kindergarten and 7th grade and 11th grade requirements, your primary care providers are open, and particularly a flu vaccine is going to be very important for all children and staff this year. Whether we go back to school or not, a flu vaccine is very important because flu and COVID don't need to be happening at the same time. So please make sure that your school district health coordinators and your school nurses are making sure that students are being caught up on their immunizations. Thank you so much.
All right, the next question, going to health department, is looking through lots of positivity rates on the counties. So I'm not going to repeat all of those questions. On metrics, is the reference to small groups of 10 or less related to only students in schools or adults too?
Are you talking about meeting in groups of no more than 10?
I believe that's what that's in reference to, yes.
The restriction of meeting in no more than 10 has to do with social gatherings. So if you've got a classroom where you've got 20 kids and they're socially distanced, or you're doing some kind of other activity that's under the auspices of Healthy at School, then that group of 10 restriction doesn't meet. The group of 10 has to do with if you are doing some activity that does not have some type of guidance that is covered by Healthy at Work or Healthy at School. If you want to have a group of people to your home, the request is no more than 10. If you're going on some type of a activity with a group of friends, it's that it be no more than 10, still with masking and social distancing. But the emphasis of this is for people to not have a house party with 250 of their best friends. I don't know 250 people, so it would be easy for me to not have a house party that big. But if you're having groups of people that do not fall under Healthy at Work, Healthy at School, Healthy at Worship, all of those guidelines that we already have, if it is a truly social gathering, that's where the no more than 10 factor comes in.
And related to this, and and this may be catching up to you, Dr. White, because some of this is changing by the hour, but we are going to be working with public health the governor made a comment yesterday, and we've talked about it a little bit on some calls today about he is open to districts being able to bring in groups of students, even during the time period that we're getting ready to go all virtual, to come in person to pick up Chromebooks to get orientation. And we're going to work with you and Dr. Meserly and others at Public Health to flesh out that guidance to see, because there were some other ideas that districts have in that same vein that the governor used the example yesterday. So that's where that 10's coming from. And then the other part of this question may be teachers and employees can still come into places of work, including school districts, as long as it's complying with Healthy at Work. However, we are encouraging, and we continue to encourage districts to always err on the side of reducing those numbers. Opening day for your teachers should not look anything like opening day this past year. One district using the pods, and no person in one pod of 20 or 25 will be over in another pod, and that's how they're going to do some professional development in person. All those ideas are okay. The governor continuing, Lieutenant Governor continuing to mention how important it is that you not have people in buildings just because you want to have them in buildings. There needs to be another reason. I use the example of Mr. Brown during virtual last year. If I have a bad internet connection where I am at home, it's better for Mr. Brown to operate out of his classroom so that so he has better connectivity with his students than Mr. Brown should be working out of his classroom by himself in the building. Probably not every teacher operating out of their classroom, but all those decisions are still up to you, but with the encouragement that every superintendent, every district look for all the ways they can to reduce the number of people in the buildings, particularly when we're in this period of what we're calling the apex of what we think is the apex of this spike.
Yes, you're right. And so you don't want to have an assembly just because you can. You want to try to keep those groups as small as possible. And we talked on Monday, I forget who I was talking with, but all of you did such a wonderful job on working last spring on how do you collect those Chromebooks and how do you collect all those pieces of property that were given to students. So you've already got a work plan. You just figure out how do you do it backwards to have them come back in an organized manner and pick up those Chromebooks and those other supplies just as you collected them at the end of the year. And y'all did a phenomenal job working on that.
Okay, so there is a clarification. Are you saying that we can have more than 10 students in a classroom before the 28th?
Well, what I'm saying is we're going to give you guidance. And the governor used the example yesterday that he is open, we are open to being able to bring in around 10 kids, socially distanced in small groups for limited reasons, giving them a Chromebook and giving them an orientation, perhaps bringing a student or two in an appropriate way for counseling. There may be some IDEA reasons to bring students in that will be fleshing that guidance out. It is not designed to be some type of a workaround to having 10 groups of 10 for a 100-person elementary school. It is designed for special reasons to be able to provide social emotional support, delivering laptops or Chromebooks, other reasons. There are probably numerous types of reasons we won't be able to come up with, but not to be used in the place of instruction necessarily. So we're going to work we're going to be working with Public Health Thursday morning on this guidance, and we're going to be amending the Healthy at School guidance for this. And I know I've been contacted today by some superintendents that have some creative ideas, and we're going to be calling them and working with them about some of those so we can be as flexible as possible, but still taking into consideration and as flexible as possible, consistent with what the governor talked about being acceptable in this environment, and then giving you that guidance on how that works without creating a scenario that will completely invalidate what we're doing and trying to not have large groups of kids in any building. So the guidance will look nowhere anything like bringing kids back, even if you've got them enough space to have them spaced out 10 in 10 pods. It's designed for very specific reasons to bring them in to help provide some services. But that comes with some other issues if you choose to do it. Equity issues, teachers that have to be there to deliver the Chromebooks potentially, but also responsible for teaching an online class when not every class member will be coming in a group of 8 or 10. So your district may not want to take advantage of this flexibility. We're going to be fleshing it out to give you the guidance on what it looks like.
All right. All right. So the next question. So I think I'm going to go to some NTI questions because there's a couple on here. So Dr. Foster, I'm not sure if David Cook is on, but I think Dr. Foster will be able to probably knock these out of the park here. Do we count NTI days as 7-hour days as we were permitted to do in the spring?
That's actually going to tie back to Robin Kinney with clock hours.
Okay, I'm not sure if Robin is on still. We can mark this. If not,
Robin had to jump on another call. We're going to flag that for further discussion. I've talked with superintendents about that. I understand. I know we had a compromise position last semester to get us through the year due to the emergency nature. Understand the concern, understand consistency issues. We're going to be talking about it, and we'll be making a determination here in the next week or so. So Tony and Jennifer, please flag that for discussion at next week's webcast as an agenda item.
For NTI, gotcha. Okay, how do we record? Is that participation for NTI as well during these weeks? Do you want to include that as well? They want to know how to record.
Yeah, we've released guidance around participation. David Cook, are you on and want to take that one?
Yes, I'm on. Can you hear me?
Yes, the question is, how do we record participation for NTI during these weeks?
You do it everybody's participation is recorded based on whether a student is virtual or in person. Since all students will be virtual during NTI, you simply record the participation based on how the emergency regulation that the board just passed identified it. So you'll just be recording every student in participation just as you were going to do for any kid who was virtual already. So you'll just be doing it for all kids that way.
Okay. There is a question here about the grants screener. There is an answer, and we did have a staff person put in there an answer to that question. But Kevin, if you want to, or Todd, somebody wants to provide the answer. We did at the Kentucky Board of Education meeting last week address that grants screener for kindergartners.
Tony, this is Todd. I'm not sure exactly what the question is, but the Kentucky Board of Education waived the timelines for the upcoming school year that exist in regulation related to the Brigance kindergarten screener. In regulation that previously was provided that it could not be administered earlier than 15 days before the first student attendance day and had to be concluded within 30 days after the first student attendance day. But those parameters around when the screener must be administered are no longer in place for this upcoming school year to allow school districts the flexibility to conduct that kindergarten screener over a longer period of time as the COVID-19 dictates based on their operations and reopening.
Yep, that was it. They're wanting to know if private schools have to follow the same recommendations as the public schools do.
We don't regulate the private schools. However, I can tell you that we have been including, and they have attended, I believe, they have a representative attending through the Kentucky Non-Public School Commission, every superintendent webcast from the Non-Public School Commission. There's been a representative, and then they feed the information out to the private schools. And then we also have representatives from the Archdiocese schools on the webcast. They were also on the governor's call and all the governor's call, just so that we can be efficient in getting the governor's recommendation, other information that they follow. So I can't speak for them other than it is my understanding without any data or anything to follow it, and I've not seen any charts or anything that shows how they are doing it, but it's my understanding that they are largely following the governor's guidance or have in the past. I don't know how they will deal with this most recent one on the extension of no in-person classes.
Okay, and then just another, seems like a clarification question. They need clear guidance on having teachers in the buildings. Can they work within the Healthy at Work guidelines, being 6 feet apart and masking when necessary?
Yes, they can, as a governmental entity with employees, you can follow Healthy at Work to have teachers and others in buildings, but you must follow Healthy at Work. Have that being said, you will need to pay attention to staff members that have other conditions. Some staff members, as counsel Todd Allen has gone over, will be presenting to you medical conditions and requests from doctors, requests for accommodations, and you're used to dealing with that in a normal school year. That's likely to happen and could happen as a result of some conditions in COVID. You will have to address those, and we want you to continue acting in good faith, to not bring people in the buildings just because you can, but for reasons that are necessary to improve instruction. If employees, and I would say this to any business, if you are in a phase where we are in TI right now, if you can have all employees or majority of employees working at home and not populating that building or that office or that front office with increasing the risk of coming into close contact, then we need to do that when we're in this period of the apex of the virus. But at the end of the day, yes, you can follow Healthy at Work and you can have people in the building as necessary.
Okay. What is the recommendation for engaging classified staff during remote learning?
Well, you've had some experience with that. And last semester, I know it looks different because it's flip-flopped. It's the beginning of the year, and it's for a long or a period of time that we didn't anticipate. Kelly, Robin, Todd, others. I know some districts, your districts have some of your colleagues have good examples of how they are doing or did this or have plans to do it.
Hi, this is Kelly. We will release some additional guidance on that. Robin and Kay and I have been having some conversation offline during the webcast, and we recognize that you're in a different place now. So stay tuned on that. You know, one of the things that's on the table is maybe you could assign classified staff to each certified staff member that could almost serve as an instructional aide or instructional assistant during this time. We could also use those staff members to help log phone calls that are coming in with parents needing assistance. But we are working on that, and we'll get you additional information. Okay, anything you want to add?
You summed it up, Kelly. Thanks.
Okay.
Kelly, this is Todd. I would add that, you know, to the extent that superintendents have recommendations or questions that they are thinking things through about how creative ways they could use classified staff within their school district, we would love to hear those so that we could, you know, review those issues and perhaps include it in guidance that we send out to school districts. I think we have a lot of opportunities to think creatively on how that works.
And just for those of you that may be joining us, I know we still have around 300 watching. At one point, we had over 500. They canceled, and he'll be issuing a video release. That's why we're continuing to go on. We'll continue to go on to try to answer all questions that we have. I know we all know obviously folks will start dropping off, but since the press conference was canceled, let's just keep moving forward, Tony.
Okay. So the next question that we have is, and I think this is going to go back to a local decision, but can teachers bring their own children to work with them?
That is a local determination to be made by superintendents and building leaders. Whenever I've received this question from superintendents before, I've just reminded them that while it is a local decision, if they decide to allow staff to bring their children to work, that they should also be sure that they have some protocols in place to ensure that, all the children aren't congregating in one area, perhaps the gym or cafeteria, that that they're following the same guidelines for masking and social distancing, et cetera.
Okay, the next question, wanting to know if, sorry, I already asked that question. It was asked twice. Sorry, going through. Many school districts have a fall break planned at the end of September, early October. They're concerned people are going to take off for Florida, et cetera, during fall break, and then they're right back where we started. So I guess they're asking for, and I think this was kind of addressed yesterday as one of the 4 reasons, perhaps to adjust a calendar. I'm not sure if this is something that we need to address now, or in potential guidance on adjusting calendars, or how a local district decides to handle that.
Districts are always free to adjust their calendar. You catch up with us at the end of the school year, and we know that happens frequently in a normal year, even during with flu, ice, other natural disasters, tornado, and it's happened, and it will happen now. If you think that if your fall break is scheduled right when we're scheduled to go, we think we're going to go back to in person at the end of September. My personal advice would be to meet with your board about canceling fall break. Unfortunately, we will have people that choose not to utilize our state parks, not to utilize things in states that have a lower rate, but they will be going to places that, if you look on the map, on the COVID map, are very red and indicating that there's a high virus count there, and that is problematic for us. That's part of the factors the governor utilized in coming to this recommendation, and it's unfortunate. You've heard me mention before, I was supposed to be in a cabin this weekend in North Georgia, even though it was going to be in a cabin and relatively safe. Canceled it because I think that was the right thing to do based on what we're seeing in other states. That's me personally, but we know you can't change the personal choices of your community members, and it is going to be something you're going to have to deal with. I've also heard from a superintendent today that when school is all in person or all virtual through September 28th, that's going to add time that they said that they will have families in their communities that use this as a vacation time. I think that's unfortunate, but we know that that's going to happen, meaning a vacation time to go somewhere where there's a high chance or a higher percentage of virus in the community.
Okay. Looks like there's a question about what if we need to bring in special education students during the day for services during NTI. It looks like that might is with the 10 rule possibly, so we could possibly put that in with.
That's right. We're working on that. There are some associated unintended issues to deal with that. We have already had a conversation with the leadership team about that. But that is also a flexibility that could be helpful. We're going to be working. I know you're tired of hearing me say guidance, but that's the best way for us to communicate with everyone efficiently. And so that this guidance is going to be in the works this week, and then we'll get that to you next week on what that looks like as far as this flexibility that the governor mentioned yesterday of bringing small groups in.
Okay, and if the health department is still on, looks like Emily at least is still on. I'm not sure. It looks like Dr. White is still on too. My local doctors are saying that local health departments are not accepting numbers of negative tests. Is this artificially inflating the positive rate?
They are reporting them to the local health department when they do them in their office.
That's what it says. Looks like they're just not reporting the negative tests.
Well, that is a problem. We are having difficulty getting people who are doing testing to give us anything other than the positive tests. So, if we don't know how many tests are being done, yes, that will affect the positivity rate. which is why we spent the last several months trying to increase the number. And we have some providers that aren't even giving us the positive tests. They're just telling people they're positive and telling them to go home and don't be around people. And that completely is against all of our contact tracing rules. Dr. Mesley?
Okay.
You're on mute. Can't hear you.
I was just going to comment that it is the labs who perform the tests who really have the most accurate data of all the negatives and all the positives. So we are working to get all of that from the labs.
Okay. Thank you both. Appreciate that. Should we anticipate the recommendation for in-person opening to be canceled or delayed again on September 28th?
Back when right now we hope that we will, as the governor and lieutenant governor said, we hope that we will be back in in-person classes on September 28th. I think it would be irresponsible to promise anything other than that. And so the governor, everyone, we're trying to act on the best information that we have. We're trying to make judgments and recommendations that we think are in the interest of the entire state, and that will result in a reduction of the cases and the positivity rate so that we can get back to in-person classes and stay in in-person classes. If we do this kind of start and stop and without this recommendation, when we are at these levels, we are going to have it's going on right now in Georgia and some other states, and it is going to be more like the sprint instead of the marathon that Secretary Duncan has advised all school districts and states around the country to utilize. So it is no one wants that to be be anything other than going back to in-person on September 28th. But in a global pandemic with no vaccine and no treatment, I can't make that promise to you, other than that everyone hopes that that's the case.
Okay. All right, the next question. We will need to provide transportation for students to pick up Chromebooks and orientation. Will that be permissible following guidance?
Haven't had that angle of the question asked yet. A very good question, and obviously a derivative of what was discussed on the call with the governor about having small groups of students to come in. That will be added to our guidance document that we're working on with public health, or the guidance update.
Okay. The next question is, when will we see the new guidance documents? We typically release those on Monday, so I'm hoping Monday,
Yeah.
Dr. Foster.
Well, considering that this is a completely new issue that was not, we weren't even talking about it until around this time yesterday, and knowing that we will have working with public health, we'll shoot for Monday, but it could be later in the week depending on the various scenarios. We do want to reach out, and we have been, and I had a conversation today to some superintendents that have contacted me that already have some plans around this type of flexibility, and so we want to reach out to hear what some of those ideas are, because that will help shape the guidance.
Okay. All right, and then there's a couple of other questions about payroll dates and stuff, but Robin is not on, so I'm going to have to flag these for next week.
And so just Tony, and just take care of this now, Karen and Tony, let's add this agenda item, proposed guidance or draft guidance on the Superintendent Advisory Council meeting for Monday, which will meet Monday, about the guidance around the small groups of students coming in for limited purposes. Ideally, we would be releasing the guidance on the Superintendent Webcast, but we may have to have just an additional discussion about it then, and then firm up the guidance mid next week.
Okay. All right. It looks like what guidance should we follow for staff that are high risk?
I think that has been addressed in several different documents. Kay, if you're still on, can you handle that one?
So Tony, could you, it was Staff with high risk?
That's high risk, and what they should do with staff who are high risk.
So I guess the first recommendation would be to check with the ADA, the Americans with Disabilities Act, to see if the person falls under that particular category. But to the extent possible, if you know that you've got people who are compromised and can at all be assigned to work from their homes, that's the best possible situation. But if necessary and you need to require disability determination, the sooner you can get that moving, the better you will be, just, from a paperwork kind of standpoint. But there are leave options, and I think we've got that guidance out, the flow charts, if people need to not be exposed in any way, shape, or form. So might look at that as well. I think a lot of that is very situational and dependent upon the individual. So to go much past the blanket guidance that we've put out relative to the leave options, I think it's a little bit of a challenge. If there's a specific question that I could help with, I would be happy to take a phone call or an email, and we can have that discussion.
Okay, perfect. I will see if I can find out who asked, or there's a couple of repetitive questions in there pertaining, and I'll see if I can get that. All right, so Kevin, I think a lot of these other questions in here are the same questions being asked, just different ways that we've already addressed. And it's now about 4:30, so I just wanted to do a time check with you to see. I'm happy to go through and see if I missed any other ones, or we can just let me know how you would like to proceed.
I think our numbers are starting to drop off on the those watching, so let's just bring it to a close. It's been a great superintendent webcast, a lot of difficult but good questions. That's what we want. And however, I understand some of the answers may be frustrating to you. I'm seeing several social media posts from your districts with your statements about the governor's recommendation yesterday. Many of them are talking about how you're taking time with your board to discuss options. I really appreciate that type of response. If you think there's a chance you're not going to abide by the recommendation, I'm glad you're not making a knee-jerk decision. Please have this discussion with your board and your community. We hope to have the webcast for local board members within the next 5 days is my goal, no later than Monday. We're working with KSBA on how to best do that so we can reach all, I think, over 800 and so board members around the state. And so that will hopefully, may not change the conversation in your community. We want to make sure we're sharing the information with your local boards as well. We can do that using technology and to further that conversation. If you believe that you're headed in a direction that your district is not going to follow this recommendation, I really need you to contact me so we can begin these discussions and to try to work through this. I want to reiterate to you, I've been involved in these private discussions with the governor, with Dr. Stack, with the lieutenant governor, and at every point it has been about what is best for this state, using their judgment, using data, using the experts that we have in our Department of Public Health in consultation with those in the federal government. There is nothing else that I have witnessed going into these decisions and recommendations. And so I ask you, as hard as it is, please convey that to your boards and your communities. And it is necessary. We're in an unprecedented time right now, and it's essential. I've talked about the education family. I believe it. I don't say that to be cute or to make points. I believe it because I've seen what happens in this state, even though, and families don't always disagree or don't always agree and often disagree. And sometimes you don't like some people in your family, but we are a family because we're pulling together for Kentucky. We know how important education is, and education has been the most important thing, I think, in this state for at least 30 years because we all came together as a state to say it's going to be. So that doesn't mean we will agree, and and we will have opinions on things, but please, I want to thank you again for the statements you're making about having these conversations before you make a decision. So my phone and door is always open. I don't always timely respond as I should because of the volume. I have several I need to call you back right now, and I would pledge to do that. Thank you again for the questions and a great webcast. We will see you online next week. And as a reminder, the Superintendent's Advisory Council will be meeting Monday, and we'll be back here at 2 o'clock on Tuesday.